Thank you so much for interviewing me. I'm Dr. Mohammed Almansour. I'm a graduate of Group 27, 2005. We finished the King Khalid University Hospital at King Khalid University Medical College. So I think I'm really appreciating that I'm one of those graduates from this really school, that medical school, that it has its a long history. Regarding my experience, I have a lot of good memories about this experience, and most of the things that I'm really still living out of those experiences, the effective role models, those faculty that they've been changing our mindset, our attitude toward our learning and our career and our future. A lot of people that really influencing us in a positive way. So they really make a big change. Also, I cannot pass this without talking about the experience that we have in Asir Central Hospital as a teaching hospital at that time. It was really a big experience, clinical practice, a lot of cases, variety. It was really making our clinical skills different when we went to the workforce place and see how are we doing in comparison to our friends from other universities. Actually, in our times, it was still a traditional system, so it's going discipline by discipline, anatomy, physiology, biochemistry, and others. So really it was hard. Those basic years was really hard for us, because it was like you are digging in a huge mountain of science. So our strategy was about trying to cut the big information to pieces. I were with my friends doing a group peer reviewing, or group teaching, group tutoring each other, sometimes taking help from our tutor and their extra time. So yes, it was not easy, but alhamdulillah, hopefully we pass it.
Okay. How interesting did you find the classes, the lectures and the labs?
Yeah, actually the lectures, it was like a traditional lectures. It was heavily loaded with the information and science. The interaction was not that much. Except from some of the tutors that they are interactive by their own nature. So it was not a systematic or formal way of interactive lectures. But also the lab was more toward I can say semi-wet lab, that we are cutting the cadavers, we are preparing the slides and doing those stuff by ourselves. It adds a lot for us, although it was also carrying a heavy burden on us in studying all of these materials. So this is what I can remember. So when we went to clinical years, things changes.
Okay, did you take notes while you were reading, or make your own notes?
Yeah, absolutely. I was a bad note taker, but we have a famous student and our colleagues in our group. They've been really taking notes in a high quality, and alhamdulillah, we've been sharing all of these between each others. And this is one of the good things that we've been practicing as a student, that we are working as a team. It was a big team, but it was a team. So we are sharing everything, whatever good sources and information we have our way to disseminate it away from our faculty. But all of that was really supporting our learning at the end.
How do you look back on those 5 years of medical school?
Really, I miss those days. I might, some of my friends, my colleagues, they don't like to remember it, but my own experience was really a valuable experience for me. It was a part of my life that it will not be repeated, because my responsibilities was only targeted toward my clinical learning with a clear target to pass the school and become a doctor. So it has a lot of difficulties, a lot of hard days, but the end result was really a huge satisfaction and award, and does deserve it.
How do you think the students of College of Medicine can make the most of the time that they spend in the College of Medicine?
Yeah, I think that they have to focus more in the building up their clinical skills, because nowadays the way of reaching the information and the data and the science is not difficult anymore. But the way of building up skills, especially clinical skills, it's not easy. So I really recommend them to use the treasure that they have it there in Abha, Asir Central Hospital, Abha Maternity, and Khamis General Hospital, Military Hospital. All of these hospitals are serving only one client, which is King Khalid University Medical School. So please go and get the benefit out of these. Go in the extra hours. Don't fix yourself only to the bedside teaching. Go beyond this. Attach yourself to the group, to the unit, to the resident, to the senior resident, to the specialist over there. Try to see more patients, performing more examination on each other and also on patients. And by the way, other opportunity that the patient there in Abha, they are welcoming the student. They are familiar with having a student all the time, and most of the time you will not find a difficulty in approaching them and examining them if you come in a polite and a good way, in a good and a proper time. So I think those things is really opportunities. They have to use it.
Okay, thank you, Dr. Mansour, for your time.
Thank you.
Thank you very much.
Thank you.